All right, so Staten Island's Emergency Field Hospital is up and running this morning. The first patients, they were admitted yesterday afternoon, and more are expected today.
The field hospital, run by Northwell Health, which operates Staten Island University Hospital. Joining us this morning is the executive director of the hospital, Dr. Brahim Ardolic. So good morning to you, doctor. Thank you for being here this morning.
Good morning. Thank you for having me.
So we understand that one patient was admitted yesterday afternoon to be treated. Looking forward to today and the week ahead as we approach Thanksgiving, how many more do you anticipate being admitted?
So we have the ability to actually take, right now as it's currently set up to 108 patients. I would expect through today that we will get into the teens of patients that we'll actually have there through the holiday weekend so that we can maintain them safely, and then that number will continue to rise.
So Staten Island is averaging about, what, 200 cases per day. You talked about your capacity there. When folks are brought there for care, what kind of care are they given, and how long do you expect them to stay in that field hospital?
So the majority of the people that are actually in the building or will be in the building will be folks that actually had a pretty significant case of COVID and have gotten much better, but just aren't ready to go home. So either they just need a little more care, or they're still testing positive for COVID, so they can't go back to an adult home or to a nursing home or wherever they were until they test out as negative. So those folks will actually spend, a significant amount of time. We fully expect the majority of patients that end up at the South Beach Psychiatric Center to be there for a couple of days.
So the critical care will take place at the actual hospital itself. That's where the ventilators will be. Are you worried, seeing the number of cases per day on Staten Island, that you may run out of critical care space within the actual hospital, let alone the field hospital?
No, so I think as far as critical care is concerned, we are prepared to actually surge up much higher than we are if need be. It's obviously not something that we would prefer to do. And I think the fortunate thing is that this is a very different disease, and we are tending to see a smaller percentage of patients that need really acute critical care, probably because the therapies are better. So we are confident that we will be able to manage the sickest patients and that we have surge capacity left in the hospital to do that.
Since these folks aren't in critical care, but they will stay there for a few days, if not longer, is there any capacity for the relatives or anyone to come and visit during that stay?
Right now, we're actually, for community spread reasons, we're actually, those people limited in visitation. So no, the answer right now is for the people that are in there. While we are have a lot of ways of communicating with them, we will do video, we will actually make sure that they communicate with their families in every way we possibly can. But really for the safety of the families and the safety of the community, right now there isn't visitation in that building because every person in there is COVID positive.
Right, so 108 patients at the field hospital. When you look at the numbers in New York State, right, they're climbing each and every day. Hospitalizations went from 1,000 to over nearly 3,000 over the past couple of weeks. As we approach Thanksgiving, what are your conversations with the state and the city officials about the weeks to come after Thanksgiving?
So the governor's office and the governor specifically, there was a lot of foresight that went into this, and there was a lot of thought that went into leaving capacity for the system as it went through. This isn't the only surge hospital that was left for the state to use if needed. There were actually several in several different areas throughout the state. We just happened to be the first one that was needed. So there is capacity through the state, and the governor really put a lot of time and effort into making sure that we could surge back up if needed. Nobody wants to see what happened in the spring happen again, and nor do I think it will.
But what does that mean when you say that there is other areas of capacity? Does that mean if somebody from Staten Island gets it and there's no more room, they can go somewhere else?
I think that we should be able to handle all the patients of Staten Island, but if we start to see that Staten Island is a leading edge and we start to see surge in Long Island, in Westchester, in upstate, there are other places the governor has talked about during his press conferences that he could surge into and open if he needed to.
All right, and very quickly before we let you go, your staff completely dedicated to that hospital, field hospital right there. What are you telling them as we head into the Thanksgiving holiday and the holidays in general, not only for their own safety, but for those who are coming in?
Yeah, our staff have been amazing. They're truly my heroes and all of our heroes, and we are asking everybody to actually make sure they wear their masks when they're not in with their direct family, and that they should be really careful about who they're introducing into their environment to keep themselves safe, because we really need them, and to keep the rest of the community safe.
All right. Well, we appreciate your time today. Thank you for what you're doing and what your staff is doing. It's so very important. And you stay safe during the holidays.
Yes.
Thank you. Happy Thanksgiving.
Right back at
You
you.
too.